The KDT NeuroFlex table includes the Mettler Electronics MTD4000 traction decompression head. The microprocessor-controlled MTD4000 provides cervical or lumbar traction by exerting therapeutic pulling forces on the patient's body with enhanced reliability and ease of use. This video has been produced to assist you in the safe operation of the MTD4000 and is not intended to replace the operator's manual. Do not operate the MTD4000 until you have read and understood the entire instruction manual. The MTD4000 system offers static, intermittent, and cyclic traction with user-definable pull patterns. The MTD4000 may be used to help relieve protruding, bulging, herniated, and prolapsed discs, peripheral radiation, sciatica, and pain associated with degenerative disc disease, facet syndrome, compression fractures, acute facet problems, radicular pain, discogenic pain, joint pain, and spinal root impingement. Do not use traction on patients with structural disease due to tumors or infection, e.g. osteomyelitis, spinal caries, and ankylosing spondylitis. Do not use on patients with joint instability, hypermobility, or spinal fracture, osteoporosis, on patients who are or may be pregnant, who present with severe cardiovascular disease, vascular compromise, with aortic aneurysm or severe respiratory disease, or patients with hiatal or abdominal hernias. Do not use traction on patients where movement is contraindicated or with patients having acute sprains, strains, or inflammation that could be aggravated with traction. Stop traction immediately if there is an increase in radiated pain to the extremities. Ensure the patient's safety switch is in place and turn the power switch to the on position. The front panel will display the version of the software and display parameters used prior to the unit being previously powered off. Ensure that the mode switch is set to intermittent and adjust the speed as desired. To select pre-saved KDT protocols, rapidly press the stop button 5 to 7 times until SE0 appears in the actual force window. SE0 represents the VAX long lumbar protocol as taught in the Kennedy decompression technique. Turn the control knob clockwise until SE1 appears and then press the start button. Notice that the SE1 displayed in the actual force window begins to flash on and off. SE1 is the VAX short lumbar protocol. SE2 is the CPM or continuous passive motion lumbar protocol. SE3 is the VAX long cervical protocol. SE4 is the VAX short cervical protocol. SE5 is the CPM cervical protocol. After selecting a protocol, press the set button as shown. The actual force window will change to a 0. Hand the patient safety switch to the patient and press the start button to begin the protocol. The patient can stop the treatment by pressing the patient safety switch. Once the button is depressed, the unit will cycle off and display an E4 error in the actual force window. Press the stop button to reset the unit. Once you've initiated a treatment protocol by pressing the start button, you may change any parameter while the unit is operating by pressing the appropriate button for that parameter, which will cause it to flash. Adjust the value of the parameter with the control knob, then press the parameter button and it will stop flashing. Then press the start key to save the new value. The parameter change will occur on the next cycle. Change the force on the fly by pressing the set button under the hold and rest force display. The hold force will begin flashing. Adjust the control knob to a different force. If you press the set button again, the rest force can be adjusted as well. Press the start button to save the new value and it will be affected on the next cycle. At the end of the time treatment, the time LED will flash and the unit will cycle itself off and display the parameters of the treatment again. Unclip the cable from the pelvic belt or cervical device and allow it to slowly retract. Do not try to force the cable back too quickly or it could cause slack in the cable and cause a malfunction to occur.